Good evening, and thank you for joining us. A new air medical transport base is coming to Davenport in response to what's being called a greater need. Maddie France joins us in studio to explain what's driving that need and how gaps in emergency medical service are getting filled. Good evening, Maddie.
Hi, John. Earlier this month, we brought you the story of an ambulance service in Durant struggling to answer calls due to short staffing. Now, Air EMS providers say they're the ones answering those calls.
And then Air Care 4 will be in Davenport, Iowa.
University of Iowa Healthcare is expanding its services in the Quad Cities. Greg Martin is the assistant director of the upcoming Davenport base.
So it's just kind of moving some of our resources even closer to help provide that life-saving care pre-hospitally for the residents of the Quad City.
AirCare is UI's air EMS system. It transports about 1,000 patients a year between medical facilities and from the scene of an accident.
Think of a traumatic injury, they need to go to a trauma center, devastating neurological injuries.
Martin says UI Healthcare saw a need for more air EMS in the Quad Cities. That extends to rural ambulance services. He says they're struggling to find volunteers.
So we do see an uptick in them calling us to transport some of these patients because they simply are short-staffed.
But UI isn't the only one seeing that increased demand.
We in the emergency medical world have seen a depletion in resources, especially with ground ambulances.
Kevin Takas is president and CEO of MedForce, a nonprofit air EMS provider based in the Quad Cities. He says MedForce flies about 1,200 patients a year. He's seen the same trend firsthand.
They're hard to hire staffing for it, and they're becoming less and less.
And the people in our hometowns are the ones facing longer response times in situations where seconds matter.
If we continue to miss calls, we have to do what's in the best interest of our community.
The ambulance service in Durant says it won't renew its emergency transportation contract with neighboring cities if it can't find more volunteers.
Right now, we currently have 9 medical members that are running 525 calls.
But Takas says that's where Air EMS steps in.
You know, we seem to be filling a niche, and we work very, very well with our first responders.
And soon, another Air EMS will be available to fill in.
We're excited about all of it. We got the clinicians in orientation right now getting trained.
UI doesn't have a start date confirmed, but the Davenport base will open sometime in the fall and take a 6-month phased approach.
I think it's only a good thing for the community to have more than one option.
Now, while AirCare and MedForce serve a similar number of patients, their billing practices are different. You can learn about how those differences impact your bottom line on our website at WQAD.com.